and welcome to our Local Health Now segment with Guthrie. My name is Caitlin Murphy, and I am joined today by Patricia Fogelman and Anya Miller, and we are talking about palliative care and hospice care, as November is Palliative and Hospice Care Awareness Month. So first we'll start off with Patricia to talk about palliative care. First off, could you kind of explain what is involved with palliative care at Guthrie, and is it offered at all locations?
Thanks for asking, Caitlin. So palliative care is the care of any patient with an advanced medical illness. So our focus is primarily on patients who may have an advancing illness that's beginning to kind of start affecting their quality of life. And when their quality of life is substantially affected, there's a significant burden of unhappiness, dissatisfaction, caregiver, burnout, etc. So our goal is to really try and get the symptoms of those diseases managed to where patients tend to feel better and their quality of life improves. And the examples I always give, for example, are, severe cancer-related pain or severe cancer-related nausea, or an advanced lung stage patient with very severe shortness of breath or anxiety. And so these are all symptoms of advanced diseases that can be medically managed and medically controlled. And everything we do can run concurrently with their current treatment, even if it's curative intent. So sometimes I may be managing a cancer patient's symptoms to get them through chemo and get them through radiation to where they're cured or in remission.
Okay, and kind of expanding a little bit on what you mentioned towards the tail end of that, when do many patients or their families consider palliative care as a necessary next step in their health journey?
So I encourage patients and families to really start to consider palliative medicine consultation when the symptoms or the burden of their illness are beginning to negatively impact their life. So are you not going out anymore or avoiding the things you once enjoyed doing because your symptoms have become so profound and so disruptive? Are you depressed as a side effect of maybe a therapy that you're on, that you're avoiding social engagement and social interaction? Are you not able to do certain things because you're in so much pain or so profoundly nauseous that you're just thinking it's better off that you don't participate?
Kind of going off, since we are talking about both palliative care and hospice today, what are the differences between palliative care and hospice?
So the biggest difference is that palliative medicine can care for patients at any stage of their disease process. So oftentimes we're engaging these patients much earlier in the trajectory of their illness. And so we are seeing patients for whom their quality of life and their symptom burden is starting to increase, but they're not really at an end stage of their illness. So these may be patients, for example, that have many years to live ahead of them, or they may be patients who have an expected normal lifespan, but the symptoms just need to be better managed. And hospice, as Anya will tell you, is much more focused on our patients who have a very severe, very end stage illness, who really want to transition their focus far more on quality of life and relief of any symptoms so that they can make the most of the time they have remaining.
If someone wants to learn more, what is the best way that they can connect with a member of Guthrie's palliative care team?
So I would urge anyone who'd like more information about us to call us here at the main campus palliative medicine office. That number is 570-887-2853. We do work out of the cancer service line. So my clinic is based in the cancer clinic, and the secretary that helps me is Michelle, and that's who you would ask for. And she will be able to kind of direct you to the right person on our team to speak to. So sometimes it may be a question that perhaps our social worker can answer, and sometimes it may be a question that maybe as one of the clinicians you would need one of us to answer. But certainly patients can call that number, any potential referring provider can call that number, and any concerned family member who maybe just wants to learn a little bit more about palliative medicine can call that as well.
Thank you so much. And we will be back. This is the end of our segment, but stay tuned for our next segment where we will delve more into hospice care at Guthrie.